All right, I'm going to demonstrate our rapid tracheostomy technique for small children. The idea of this is we're going to make a skin incision. I'm going to quickly dissect down the soft tissue around the trachea so I can feel the trachea with 2 fingers. I'm not going to clean it off, but I'm just going to feel where it is, so it'll still have some muscle and maybe some soft tissue on it. I'm going to run this single stay suture sagittally down the trachea, grab 2 or 3 rings, and then then I'll have control of the trachea. I'll make a incision into the trachea above where I have my stay suture in case I accidentally cut the trachea in half. I still have control of it. And then I'm going to take my neonatal bougie, put it in the hole, and then my 3.0 ET tube over the top. So I'm going to do it in real time. I can't feel where this pig's, where to go exactly. And this would be good for a chubby kid where you can't feel the landmarks very well. But ideally, I'm going to go first, second, third, or fourth tracheal ring. I don't want to go in the cricothyroid membrane because it's too small in a child. So first, my skin incision. I'm going to guess where the first, second, third, and fourth tracheal rings are. I'm going to quickly make a skin incision over that area. I'm going to make it full thickness of the skin, but try not to go into the trachea. And then I'm going to take my blunt instrument and dissect sagittally, try to figure out where's my trachea in there, at least get the soft tissue around the edges of the trachea loosened up so I can then feel where it is. I didn't quite go deep enough. Okay, so then now I can feel where my trachea is. It's pretty far down there. And I'm going to put my stay suture in. Now I have control of the trachea. It's way deep in the hole here though, in this pig. And now I'm going to I can feel the trachea, but I can't see it. And now I'm pulling up on my stay suture so I can get the trachea to come up. It's a little bit flexible. I'm going to make my incision into the trachea. I'm going to get the neonatal bougie into that hole. And then I'm going to put my ET tube over that, push it down into the hole, about 1 centimeter deep. And that's it. That's how quick it is. So I still have total control of the distal part of the trachea in case something goes wrong. I can start again with my incision above, but I'm in place, and it should take less than a minute, maybe 30 seconds. Okay, so now we've opened up the pig's neck. That was a good demonstration of the procedure because it was actually fairly difficult and deep, but it still ended up in the right place. So now I'm going to show, we've opened up the neck, obviously, pretty wide, and you can see where the tracheal incision ended up being, and we pulled the stay suture out. But I'm going to do the procedure again and kind of show you, what I was feeling down in this hole and where I ended up going. So I'm going to, I make my skin incision. You can be pretty rough with the soft tissues as long as you're dissecting in the sagittal direction. You're not going to hurt anything with a blunt instrument. So dissect around the trachea till you can feel on both sides of it. And then you're going to take your stay suture and run it down the trachea. Grab a couple tracheal rings, come back up. And you want a needle. You can see this needle is like 180-degree needle, so it can take a deep bite and make a short bite at the same time. And then I'm going to take my scalpel. Where'd my scalpel go? And then I'm going to pull up. And you can see this is a little bit flexible. I can pull the pig's trachea up into view, or at least till I know I can have control of it. And then I make a sagittal incision, maybe even a cross incision above here into the trachea. And then I can get my neonatal bougie into that hole, put it down the trachea until it stops, and then load my ET tube over the top of it, and then just push the ET tube. You could just push it so the cuff is below into the hole, into the trachea, or to the black line, and you're done. So pretty simple, straightforward procedure, and it's quick with a single stay suture. And we still have good control of the trachea in case something goes wrong. So I'm going to go over a few things that I didn't mention earlier while we were doing the procedure, but it's really important to, even if it's a trauma patient and you're trying to protect the neck, at the point where you're doing an emergency surgical airway, that's the most important thing to the patient, is to get the airway in quickly. And you're going to you can't do it if the neck is flexed, because if you feel on yourself, your trachea goes under your sternum for the most part when you flex your neck forward. So you need to extend the neck. You can do it carefully and slowly, but extend the neck back, and you'll be able to feel the trachea much better and get to it much better. The other thing is that this is a tactile procedure only. Like you could see the first time I did it, it was deep. I could feel where the trachea was, but I could not see it. And so I have my index finger of my non-dominant hand on the trachea, and I'm taking my bite with a suture directly under my finger. And that's what you have to do when you're in a hurry. You don't have time to clean it off. You don't have time to get rid of the blood. You're just gonna have to do it by feel, and that's how you do it quickly. And that's the major difference between this and a formal trach, is you're not gonna see what you're grasping with a suture. But once you make the grasp, you'll be able to pull up and you'll be able to feel that you have the trachea. And then you're gonna, again, feel the trachea above, and kind of blindly put your scalpel down into that trachea that you can feel. So if you try to see all the structures, it's going to be way too slow. It's going to be several minutes long. And the way to do it quick is make it all tactile.